Good morning, good afternoon, and good evening to all those who uh, are joining us here today, depending on where you are in the world. Welcome to our webinar, Driving Medication Safety in Community Pharmacies Through Continuous Quality Improvement. This session aims to be a big action-packed session like many of our others. And on behalf of myself, Alicia Zada, I'm the executive director of the Value Collaborative, and my fellow co-host, Ina Ajla. Thank you for joining us here today. We're going to start things off with, from a Canadian perspective, the land acknowledgement. We acknowledge we are hosted on the lands of the Mississaugas of the Anishinaabe and the Haudenosaunee Confederacy and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and Inuit people. We are grateful to live, work, and play on this land, and we want to contribute to the implementation of the Truth and Reconciliation Commission's 8 health-related calls of action. If you wish to recognize any other peoples from the areas that you are joining us from, feel free to use the chat window. In addition to that, the chat window is open. If you have any questions that you would like to ask, please do so. Like I mentioned, today's aims to be a pretty action-packed session, but 3 major objectives that I'm hoping that you leave here today with. The first is being able to understand what is this concept of Lean, Six Sigma, continuous quality improvement, this big bucket of quality improvement. What are some of the methodologies that kind of fall within that? 2, I hope that you're able to start to explain the problem-solving approach to actually addressing a lot of these problems, and being able to look at it from a pharmacy environment perspective. And lastly, I hope that you're able to start to understand what the components are for building a culture of continuous improvement. It's great to have, the tools and to kind of know how to solve problems. But if this is something that you're very interested in bringing into your own organizations and into the DNA of your organization, what are the major components to that? So today's agenda, we're going to start off with a little bit of introductions, some objectives, and why should we actually be focusing in on CQI now? Then we'll move on into what are these terms: Lean, Six Sigma, continuous quality improvement. What are these, and how do they kind of fit together? Then I'm going to introduce you to the 5 stages of solving problems. What are the techniques that you're going to be using to approach problems going forward? We'll hope to cement this a little bit more by actually sharing with you real life pharmacy examples of using the same tools and techniques that we're talking about here today. And then, like I mentioned earlier, what are the components necessary to start to build this culture of continuous improvement in your own organizations? And then at the end of today, if you're interested in learning more, we have some information on how you can actually expand your knowledge. With that, I'm going to hand off the baton to Ina.
Thanks, Ali. Welcome, everyone. A little bit about ISMP Canada, just before we begin and diving deep in. ISMP Canada is a national, independent, not-for-profit organization. For over 20 years, we have been a trusted partner in strengthening medication safety through timely learning, sharing, and acting to improve healthcare. Most of our funding for operations comes from governments or healthcare delivery organizations. Let's start a little bit by understanding a bit more about how we learn. We collect, aggregate, and analyze data on medication safety from practitioners, from consumers, caregivers, and others, so that this knowledge can then be used to understand what issues and errors are occurring with medications and why. With this knowledge, we develop and disseminate lessons learned with compelling, actionable, evidence-informed recommendations for reducing preventable harm related to medications. This knowledge and expertise is then used to purposefully partner to implement, sustain, and evaluate medication safety improvements in practice. All of this work is in collaboration with organizations, practitioners, consumers, caregivers, and other partners across our healthcare system. Back to you, Ali.
Thank you. So that's ISMP Canada. Who are we from the Value Collaborative? Well, we're a boutique consulting firm that focuses a lot about performance improvement, quality improvement, and basically building cultures of continuous improvement. And we do this through three major structures. The first being project support, partnering with organizations on a key problem that they have in their organization, and through facilitation, project management, and a variety of techniques, facilitation, helping them solve those problems. The other component that we do is training. A lot of what we're doing here today, whether it be yellow belt certification, green belt certifications, looking at lean management systems, a variety of different kind of programs that we have under our catalog to help empower and again create more skills within this sphere of uh, process improvement. The last piece that we do, strategy, working with organizations on designing what is that 3 to 5 year strategic plan looking like? Where do you want to go? Where are you? And then how do we take that strategic plan and perhaps change it into an operating plan for the year? As I mentioned, my name is Ali Shahzada. I am the executive director of the Value Collaborative. I've been working in this in healthcare now for well over a decade. Long-term care, pharmacies, hospitals, you name it, I've kind of touched into it. Uh, but that's a little bit about me. I really want to know who's around the virtual room here. We have roughly, I think, 18 people that have joined us here today. Please, in the chat window, I want to know who are you? Your name, what organization and role you have, and why did you register? You're taking such precious time out of your day to join us here. But why? What are you hoping to get out of today? What was the motivation for you to attend? So please, in the chat window, if you're able to kind of share that, I am very much interested in taking a look. As you do so, I'm going to hand this off again to Ina to talk a little bit about why CQI.
Thanks, Ali, again. So you may ask, why focus on CQI now? With over 600 million prescriptions dispensed annually in Canada, medication safety translates to patient safety. Through analysis, we can say that unsafe medication practices and medication errors are a leading cause of avoidable patient harm that is estimated to have a global cost of $42 billion annually. Next slide, please. In a 7-year study conducted by ISMP Canada in 2017, we identified over 131,000 events reported by community pharmacies in Nova Scotia. Over 98,000 of those reports, or approximately 75%, were quality-related events. Overall, the good news is that 82% of those events did not reach the patient, but about 1% were associated with patient harm. That may not seem like a higher number, but it translates to 928 patients, next, who experienced harm due to a medication error. Unsafe medication practices also impact families and caregivers. It impacts both time spent both from a patient caregiver perspective and from a pharmacy's perspective. The stress and frustration experienced by all involved and all impacted is significant, and ultimately it has financial implications for the community pharmacy, for patients, and for the overall healthcare system to correct the event. Next slide. Now moving on to 2023 and to the larger national picture. An analysis of the top 10 incident types reported to the National Incident Data Repository from community pharmacies in Canada for harm-related incidents reveals that the top 3 types of incidents accounted for over 12,000 reports. This means that just the top 3 types of medication errors of incorrect dose or frequency, incorrect quantity, and incorrect drug resulted in avoidable harm for more than 12,000 patients in Canada in 2023. This then translates into that greater impact that we talked about on the previous slide on time spent, frustration, stress, cost to correct the event, and even greater impact on the patient and their families or caregivers. Next slide, please. The complexity of processes in community pharmacies is increasing with the changes in scope and added workload. Improving both safety and efficiency for those complex processes, which is why is imperative, which is why we want to talk about focusing on CQI today. And back to you, Ali.
Thank you. So we talk a lot about CQI. Let me put this in through another perspective. Oftentimes, when we are solving problems, what do? We rush in there. We rush into the problem and we start to say, what can I do? What can I do to start solving this? This can't happen anymore. I need to find a band-aid. I need to find a plug to plug this hole. There's this big issue that I'm facing. People are maybe at risk, or it's costing a lot of money, or we're making a lot of mistakes for a variety of different reasons. There's this problem and I need to solve it. So hopefully this sounds a little bit familiar to you. Now, this concept of downstream problem solving. And I borrowed this from a book called Upstream by Dan Heath. Downstream problem solving is something that we typically do. We see a problem, it has occurred, and we try to solve it. Now, this is the reacting to when problems have actually already occurred. And we typically do this because it's a lot easier to see and to feel and to actually experience the problem when it's staring at you. However, unfortunately, this is not the right way of solving problems. Why? Because the problem has already occurred. You have already faced that problem. And if you deal with that problem at the surface level, it may just keep popping up over and over again. Any of you who likes to do gardening, you know that you have weeds in your garden, perhaps. Well, at least I do. And if you just take the weed from the surface, it keeps growing back up. This is why you got to go into the root. You have to understand, why is that weed actually growing? This is the concept of upstream problem solving, addressing a problem before it actually occurs, trying to prevent that problem from occurring in the first place. This is a much more sustainable way of solving problems, but recognize that it's a little bit more difficult for us to do because it requires more effort to measure, to collect data, to perhaps observe why certain things are actually happening. And it requires us to do a little bit more systems thinking, understanding what is causing this to occur. Because oftentimes, what you'll notice is that the problem that you're seeing on the surface is very different from the root cause that is actually causing it. So upstream problem solving is what we are trying to do through CQI. Now, why are we not doing upstream thinking? Well, I mentioned some of it earlier, but these are the three major reasons that Dan Heath says in his book. The first one is problem blindness. The more you're in that problem, the more you are experiencing that problem, slowly, you become blind to it. It's not a problem anymore. It's just the way that we do things. Often, like when a smell is in a room, you end up becoming blind to that smell because you're just experiencing that. Another reason is the lack of ownership. Many times the problem is crossing multiple different departments or different individuals, or there is no real owner of this specific issue. It is a shared problem. So if there's no one owner, it's a little bit more difficult for us to actually start to solve that. And the last one, which is not a surprise to anyone in healthcare, no time. It's very difficult to sometimes take the time to take a step back and say, why is this problem occurring to begin with? So with those barriers to upstream thinking, what I'm challenging us to do today is to flip this, to start to think about, how do we address these barriers through CQI? And to do that, I'm going to pose certain questions. For problem blindness, how do we go from problem blindness to creating a culture that continuously anticipates risk? How do we create a culture where people are constantly thinking about what is the next potential problem that might occur? The next issue for lack of ownership, how do we flip this into creating shared responsibility and accountability in identifying opportunities? How do we make it everyone's job to identify problems? Everyone's job to constantly be on the lookout for where can we be better as an organization? And for the lack of time, how do we flip that to how do we make it easier for staff to solve problems? We don't want problems to be massive projects all the time. How do we bucket this problem-solving approach into something that we can do very easily? By doing this, hopefully we can start to move the needle on upstream thinking. Now, this really relates to continuous quality improvement and why we are here today. Continuous quality improvement is a philosophy. It is the idea that you are never the best. There's constantly better and better ways that you can start to solve problems. And quality improvement is the approach that you will use to actually improve your processes. What are the structures, the processes, the services that you need to look at, and how can you rejig them by eliminating the things that are not needed? Like I mentioned, it's a philosophy. It is not a one and done kind of thing. Rather, it's part of your DNA as an organization. How do we ensure that we are constantly improving? Many times organizations think of continuous improvement as a one project. We did it. Yep, we continuously improved. No, you just did one project. So this idea of improvement, you can imagine, is a long-term kind of thing. And it can be done through incremental improvements, changing the culture slowly by focusing in on key initiatives and then building momentum over time. Or you can do it in a quick step fashion by focusing in on intensive projects and working on a specific issue, making very good improvements there, then moving to the next one. Both approaches works. It's whatever's best for your organization. So with that, there is a bunch of factors of what is CQI, and there's a bunch of things that CQI isn't. Let me start off with what it isn't, because oftentimes working in the QI space, when people see me coming down the hall, they might feel a little bit anxious. They'll be like, oh, here's the QI guy, right? He's going to be making me work harder or make me work faster or, put me at some sort of risk. And that's unfortunate because QI or improvement, continuous improvement, has gotten a bad rap over the years in the sense that some organizations will use QI as a way of cost cutting and control and things that are not really good for the organization. And like any kind of tool, it can be used as that. But that is the most unsustainable way of making improvement because continuous improvement is not about making people work harder and faster. Rather, it's about working with people to identify what the problems are and for them to come up with the solutions to them. If you use this approach to, cut costs and make life a little bit more difficult for people, well, the next time you come in to get more ideas on how to make things better, they're not going to really want to work with you. So it's not a very sustainable way of working. Another piece is this idea of reducing time with patients. Couldn't be further from the truth. In fact, continuous improvement, if you're done correctly, you should be freeing up time so that you can reinvest that time to things that actually matter, which is spending more time potentially explaining medications to patients or doing some certain checks, spending more time on value-added tasks. So long story short, the definition that we are using for CQI or continuous quality improvement is providing maximum value to our staff, our patients, our customers with the safest minimum number of resources. Now let's focus in on that sentence a little bit. First off, maximum value. How do we start to give the most value that we possibly can to our customers? What do they want in this or by coming to us, and how do we give them the most of that? And then the second piece is by doing so in the most responsible way through the safest minimum number of resources. I don't know about you, but I don't have a money tree in my backyard. So this is why we have to be very cognizant of how are we spending our resources. So how do we get the customer what they want in the highest quality possible, but with the safest minimum number of resources so that we can take that savings and reinvest it to the next patient or to our staff or to anything else that matters. Now, with that, and I kind of referred to it earlier, there are two methodologies under this umbrella of QI. There's a variety of different vehicles that you can use to improve quality, but there's two major ones. The first is Lean, and the other is Six Sigma. And perhaps you've come across these two terms in the past. Now, Lean is all about trying to make things smoother, improving flow. And Six Sigma looks at this idea of variation. Now, before a long time ago, these two methodologies used to be very different, but over the years, people have started to see that they actually work very well together. And in which case, we no longer have Team Lean and Team Six Sigma. We are now more and more working on Lean Six Sigma as one cohesive methodology. Like I mentioned earlier, Lean is its own methodology. It's focused in on creating flow. What do I mean by that? Well, think about a stream, right? You have this river of water that is moving from one end to the other. Now, if the stream flows very well, the water has very little ripples in it, and it's very easily moving from one end to the other. However, the more garbage and rocks and filth you start to put in that river, that water starts to get constructed or constricted. And the water cannot move from one end to the other in a very easy fashion. It's the same thing with processes. You all have processes in your organization, and the more waste you put in those processes, the more waiting, the more defects, the more any of waste that you put into those processes, it's going to start to restrict. So this is when you start to see processes are not moving as fast as they should, and you're making a lot more mistakes because the flow isn't there. And so Lean has 5 principles, as you can see here, that aim to improve that flow. Try to make processes move from beginning to end this seamlessly and as easy as possible. The other methodology is Six Sigma. Six Sigma looks at defects. So any process, at the outcome of that process, is a product or a service or a deliverable. Could be HR processes, it could be medication administration processes, it could be data collection and data entry processes. They all have a certain outcome. What Six Sigma is very worried about is how often is that outcome correct? And many times, sometimes the process works and sometimes the process doesn't. Organizations that are very focused in on Six Sigma, they say that 99.72% of the time, because my organization is at a Six Sigma level of accuracy, 99.72% of the time, I'm going to have the correct outcome. So every time this process occurs, 99.72% of the time, it is done correctly. Imagine 99.72% of the time you do something, it is correct. That is a huge mission. And you might be thinking, how does anyone do that? That must take a lot of technology. It must take a lot of, data, a lot of work to kind of put that together. Work is true, but technology, maybe not. And to highlight that, I'm going to share this quick video here on just a simple process.
Mumbai has over 18 million people. The city, it's unpredictable. But amidst this chaos, there is one thing that is nearly 100% reliable. It's your lunch delivery. The Dabbawalas of Mumbai are an institution. A Dabbawala is a guy who delivers homemade lunches.
मेरा नाम किरण गवांदे है और मैं डब्बावाला हूँ। बिजनेस में ज्वाइन किया और तब से मैं 12-13 साल से काम कर रहा हूँ। खाली बॉम्बे में ही हम रोजाना 2 लाख डब्बा पहुँचाने का काम, खाली साइकिल और ट्रेन ये दोनों चीज़ों से मिलके डब्बा पहुँचाने का काम करते हैं।
This is how the system works. The Dabbawala comes to your home and picks up your lunch. He goes to the train station where all the other lunches are. They are sorted and then delivered out into the city to be dropped off at your office. You eat it, the Dabbawala comes, picks it up, and brings your lunchbox back home. That's the key word, home. These aren't takeout delivery guys. They're delivering you a meal straight from your kitchen. This system, while seemingly rudimentary, has been recognized as one of the most efficient logistics systems in the world. Dabbawalas have an accuracy of 99.99% in their deliveries. Per million transactions, less than 4 mistakes are made.
तो सबसे इम्पोर्टेंट चीज़ होती है कि जिस डब्बे के ऊपर जो कोड होता है, कोड में क्या होता है कि मतलब कुछ आंकड़े डाले जाते हैं, कुछ कलर कॉम्बिनेशन होता है। गलती मतलब कि कोड डब्बे के ऊपर इतना परफेक्ट डाला हुआ है कि उससे गलती होने की कोई संभावना ही नहीं है।
Crisscrossing side streets on bikes, balancing trays that weigh almost 150 pounds on their head, this group of 5,000 men, they help define the city.
बॉम्बे में कम से कम उसको 125 साल हो गए। ये सिस्टम और किसी दूसरे जगह पे नहीं चालू। थोड़ा सा हार्डवर्क तो है, तो आदमी मतलब थोड़ा सा थकता है, लेकिन क्या वो अगले दिन वापस एक नए जोश से स्टार्ट हो जाते हैं।
These guys are out there 6 days a week, monsoon or shine. Life in Mumbai, it can be chaotic. Your train might be late, your power might go out, but damn it, your lunch will be on time.
So, like I mentioned earlier, accuracy doesn't have to be expensive. I want you to reflect yourself on your individual practices and the different processes that you deal with on a day-to-day basis. Which one of them could you say is a Six Sigma level accuracy? 99.9% or 79% of the time, it's going to be accurate. And what I really love about this video is that you're seeing a process that has a lot of variability in it. Different train schedules, different areas of the city, you have traffic, you have staff who potentially can't read or write depending on their background, and yet they're still able to create a very high resilient process that is accurate to their point 99.9% of the time. So something for us to kind of think over in our regular day-to-day processes. So I mentioned a lot about, this idea of solving problems now, and I've kind of highlighted why it's so important and the impact you could possibly have by doing this. Well, what is the approach? What is the approach that you can start to use as of today to start to solve problems in a more structured manner? Well, to do so, I want to introduce you to this concept called DMAIC. Okay, DMAIC. It is an acronym for the structured problem-solving approach in CQI, and that stands for define, measure, analyze, improve, and control. These are the 5 stages to solving a problem. And we're going to spend some time now talking about what these individual 5 stages are. The first, anytime you have a problem that you need to solve, the first is going to be to define it. What is the problem that you are looking to solve? How do you know this is a problem? Well, who do you need to talk to ensure that this is a problem? What is your ultimate goal with this problem-solving initiative? These are some of the questions that you're going to be asking at stage one. It doesn't have to be a lengthy process, but really getting a concrete sense as to what is the problem and where do you want to go with it. Now, there's a variety of tools that can be used to kind of solidify the answers to this. Some is Kano analysis, a SIPOC diagram, project charters. These are just some examples of tools that you can use at this stage to really define what your problem is. But one I'm going to spend a little bit more time on is this concept of going to Gemba. Gemba is a Japanese word for the actual place. What does that mean? Well, the idea here is that very little problem solving can happen behind a desk. Rather, you need to go to where the work is being done. Go to where the problem is being faced. Go to where the people who actually live and breathe that problem are and interact there. Watch the process. Observe how it's going wrong. Talk to the people. By doing that, by going to Gemba, by going to where the work is actually being done, you're going to have a better idea of what that problem is. So it's a very crucial tool that you can use during your define phase to really define what the problem is. In fact, anyone who I coach, I recommend to do Gemba throughout the 5 stages, because the more time you spend where the work is being done, where the problem is being faced, the more you're going to learn. And when you get into solving the solution, you're going to actually be able to see why it hasn't worked. The second stage, after you have a good sense of what the problem is that you're trying to solve and what your goal is and who the people are that you need to talk to, you now go into the measure phase. The measure phase is all about collecting information, collecting data. What is happening right now? What kind of data exists and what is that data saying? How often is this problem happening? Are we seeing any trends based off of the data? Is this a problem that happens during the evenings or during the days, or is it a seasonality to it that it's more of an issue during the summer or winter months? Collecting data is a very powerful way of starting to really unravel a problem. Tools that you can use, Gemba again, shadowing and interviews, data collection like tick sheets and using graphs like histograms. And another very powerful tool is the value stream map. A value stream map might be very familiar to you. Some people might remember the concept of a process map, very similar kind of concept. This is a tool that allows you to create a visual representation of a process. And by building up a value stream map, you're able to start to identify, okay, what are the sequence of steps that are occurring? How long are certain things taking? So this is an actual value stream map that we created when we were looking at a long-term care home, a senior care home, and how residents are placed into that senior care home. And so the blue represents steps, the steps that it takes to do that process. The yellow represents the time. How long did each one of these steps take? And the red are all the opportunities, all of the problems that feed into the larger problem. So this is the goal of the measure phase, is to start to look at data, start to collect information, whether it be interviews or actual data collection or historical kind of electronic collection, and start to take that big problem that you've identified and break it down into smaller chunks. What is it that's causing this bigger problem to occur? Once you have that good sense as to what are the different pieces that are causing this bigger problem, you can move into the next stage, which is analyze. Basically thinking about what are the root causes? Why are these individual problems occurring? What is it underneath the surface? Again, remember that concept of upstream thinking? what are some of the upstream things that are occurring that are causing these individual problems? Now, questions that you'd be answering here, what are factors are causing the most problem? What are the root causes? And different tools that you could use are graphs, fishbone diagram, 5 whys, an FMEA, a failure mode effect analysis. These are different tools that you can actually use during this stage to really get to the root cause. Another concept that I think is going to be important for you to know is the concept of 8 wastes. 8 wastes is a way that you can start to analyze what should and shouldn't be part of my process. The 8 wastes are 8 commonly occurring things in any process that we should be aiming to remove from our process because they add no value to anyone or no value to the customer, at least. The acronym that we use to remember the 8 wastes is called downtime, and that stands for defects, overproduction, waiting, non-utilized talents, transportation, inventory, motion, and extra processing. Again, these are 8 things that we should be looking to remove from our processes as much as possible. I won't go through all of them, but I'll highlight, a few. Defects, for example. Anything that you have to do again because there was a mistake. Where do you start to see a lot of defects? Why do you see so many defects? What is occurring that you have to redo that step over and over again? Because if a mistake is made, all of that effort that you spent to get there has now been wasted and you have to redo it all. So we would want to understand where the defects are. Motion, for example, is the idea of how is your layout of your space? How much movement do you have to do a specific process? Where are your syringes? Where are the canisters? Where are the labels? Are they all close together, or are you finding yourself walking all over the place? Well, that creates fatigue. That can potentially create injury, and it creates more additional time in our processes. So we would want to reduce motion. And there's different tools like a spaghetti diagram that can be used to highlight that. So for your sake, 8 wastes being a very powerful lens to look at any process, whether it be a pharmacy process or a HR process or anything to make it better. The next stage now that we know what the root causes are that are causing this problem, we now can move into the stage of actually doing something about it, the improve stage. Now I'm going to pause here for a second because what do we typically do? Remember that downstream thinking or the downstream approach to solving problems? We see a problem and we improve it. We try to solve it right away. Well, what the DMAIC approach is doing is it's separating it far apart. No. You see a problem? Well, first you're going to define what do you actually see? What's the problem that you're trying to address? Then you're going to collect some information and say, why is this problem occurring? What is the data saying? Then you're going to analyze it and see if there's any root causes. Then you can get to the point of doing something about it, making some improvements. Now, the amount of time it takes to get from there to here really depends on the scale of the problem. If it's a very quick problem or a very small problem, you can get there from define to improve relatively quickly. The bigger the problem, the more time you're going to spend. In the improve stage, though, there's a rationale that we want to do. One thing is we're not going to just test, we're going to implement solutions. Rather, we're going to test them out. And we have this thought concept of PDSA thinking. Plan, do, study, act, running experiments to increase our confidence in our solution. We're also going to be collecting data during this stage to say, are we actually making an impact the way that we thought we would? And we would be looking at different more effective ways of making solution. Here's a secret. Education and training are not always the best way of making change. Rather, Are there more effective ways like visual management, error proofing, looking at the flow of things, creating standardization? Those are different ways that we can actually create more robust processes and solutions. Again, I'm just going to chime in. If there's any questions from that are popping up at this point in time, feel free to use the chat window. The last stage now is the control. So imagine you've defined the problem, you collected some data, understood what is causing that problem to occur. You then did some root cause analysis, understood what is really under the surface that is potentially creating this issue. You then made some improvements and you saw some great results from that. Does that mean you walk away? No. The last stage, which is one of the most important stage, is the idea of creating control. How do you make the process stick so that if you win the lottery or if you move to a different organization, this problem doesn't come back? So audit boards, standard work, creating potentially staff huddle boards. These are different concepts that you can actually use to create sustainability, to make sure that that process, that new change that you've made actually sticks. Okay. So those are the 5 stages of solving a problem. Now, to highlight how this has actually been applied, we're going to share 2 examples of real life projects from a pharmacy perspective. The first one comes from a long-term care home, actually, that was seeing that an increase of 62% medication errors from the previous year. So you can imagine that this was a huge shock to them, that why have their medications errors started to go up by 62%. So they followed this DMAIC approach. And what they did is they started to collect some data. They started to say, why are we seeing so many errors? They graphed it all out and they saw that they had an average of 14.6 errors per month. Not only that, but they did a little bit of a deeper dive into it. And they said, well, why? What type of errors is causing this? And what they found was that missed medications was the highest contributor for the bigger problem of medication errors. So what does that mean? Well, it means that if we address just missed doses, it's going to solve most of our problem. By looking at the data even further, they identified that not only is missed errors a big issue, but supper time happens to be the most popular time for us to miss medication. And that started to make sense to people. Like, why is it that during supper we're missing so much medication? And it's because it's a very chaotic time. And so based off of that, they started to implement a bunch of solutions. They color-coded their medication sheet. They created this visual management tool where medications, when they would be coming up from the pharmacy, they would be laying flat in the bin, and then after the nurses had administered the medication, they would put them on an angle. So it would be a very quick visual representation, low cost, easy to do way of saying who has got their medication and who has not. Long story short, what were they able to do? Well, in a few short months, they were able to drop their number of medication errors from 14.6 to 3 per month, just by using the DMAIC approach and many of the tools that I just highlighted here today. For the second example, I'm going to hand it off back to Ina.
Thanks again, Ellie. For this second case study, I'd like to share this story from my experience as a pharmacy manager, where I had just begun a new role at the pharmacy. A young child had been receiving refills of compounded clonidine from the pharmacy for quite some time. After receiving 1 dose of the most recent refill, the child became extremely drowsy and unstable. The child was taken to hospital, where it was determined they were likely presenting with clonidine toxicity. As a parent, as a pharmacist, the feeling was overwhelming. I needed to find out exactly what had happened and to ensure it would never happen again. The questions that Ali has talked about today so far came flooding forward. How do I approach this problem? What can I change? What resources do I have? What is within my control? How do I create an environment of continuous quality improvement? So let's talk about the answers to these questions over the next few slides. So the Canadian Incident Analysis Framework gave me a place to start. The steps in this framework helped me to formulate a plan to move forward to improve processes within the pharmacy to ensure patient safety, to support the pharmacy team, and to ensure business sustainability and viability. The first step in this framework is to provide an immediate response and patient support. I provided all the information I could to the parents and the physician to support the patient's recovery. An initial review of documented calculations and weights did not reveal any obvious errors. We needed to dig deeper to understand what happened. While we did this, we outsourced all compounding for children and any compounds with APIs with a narrow therapeutic window to a compounding pharmacy, to a specialty pharmacy. The next step was to conduct an investigation, conducting an audit of the weight of clonidine trituration on hand to determine if there was a weighing error, a review of calibration records for the weigh scale to investigate if there was an equipment failure. All compounds prepared over a period of days before and after the clonidine compound were made were reviewed to determine if possibly cross-contamination had been a contributing factor. And finally, a review of any other recent error reports and documentation from other prescriptions made from the trituration. Next, step 3 of the framework is employee management, which was a critical step. The pharmacy staff had been compounding for many years, and I was a new leader to the team when the error happened. Safety culture was a key focus through this whole process. Next was step 4, analysis and quality management. An analytical assay of the compound later revealed the preparation contained 10 to 14 times the labeled concentration of clonidine. And the next step 5 was to follow through and close the loop. On the next few slides, we'll dive a little deeper into step 4 and about what the analysis revealed in step 5 and how I followed through to close the loop. Next slide, please. So the incident analysis revealed 5 contributing factors or gaps. First, there was an inadequate standard for a final check process, which should have included a process for an independent double check by a pharmacist during preparation. This was a key contributing factor which resulted in an incorrect reading of the API clonidine weight by a non-pharmacist registrant, resulting in a missed decimal point on the weigh scale. Next, second, there was an incomplete documentation of clonidine compounds made in the pharmacy, which made backtracking of steps somewhat challenging. Next, third, a culture of safety was not well understood by the staff to facilitate reporting of errors and to focus on designing a safe system to proactively assess the daily risks inherent in the operations of the pharmacy. And next, fourth, a lack of policies and procedures which incorporated the NAPRA model standards for non-sterile compounding meant different staff members prepared the same compound in different ways. And lastly, there was a lack of familiarity or training with the preparation of the compounded by the staff member who was preparing the compound. Now I understood what happened. I faced the questions that many of you probably have also faced. How do I make changes to the process to ensure safety moving forward within the resources that I have allocated to me? Resources being time, people, money. How do I support the team to follow through and close the loop? Next slide, please. As I mentioned earlier, our immediate response was to outsource all high-risk compounded prescriptions to a third-party provider until we completed the investigation and implemented procedures to reduce the risk of occurrence. So how did we close the gaps? And when I say we, I do mean the entire team, because the change required the entire pharmacy team. So the solutions we implemented included, first, growing a culture of safety through education with the pharmacy staff. A discussion on the incident itself was conducted. Education on changes in policies and procedures and regular safety huddles occurred. We also identified training opportunities and conducted regular skills assessment of staff for high-risk processes. Next, we designed a system whereby a pharmacist performed independent double checks for the ingredients, the CAS numbers, weight verification, and compounded calculations. Next, we used technology to reduce the risk of another error or confirmation bias when reading the scale. We purchased a weigh scale that printed out the weight of the ingredient to be included as part of the prescription documentation. Next, we added a designated compounding area to minimize distractions to the pharmacy staff while compounding or while engaged in high-risk processes. And finally, policies and procedures were created, which included the NAPRA model standards. And we did this by enlisting the services of a compounding subject matter expert. Next slide, please. So you may be wondering, did those changes have an impact? And how did the steps so far consider the Lean Six Sigma approach? How was I able to make the changes with the limited resources of my labor budget, the time, and the financial resources allotted to me? Like many of you, the pharmacy was very busy, but we were determined to find a way. I can tell you that the system changes we implemented created safeguards and opportunities to catch potential errors. Potential incidents became good catches, and the safeguards were working. With the standardized policies and procedures, we gained efficiencies in time, which supported the independent double checks by the pharmacist. We experienced less product wastage by detecting errors before the compounded products were made, and therefore less write-offs. With a focus on safety culture and training, an environment was created where staff felt supported and stayed long-term. These changes led to a reputation in the community as a pharmacy that cared, and the business grew because we did the right thing. The challenges in the short term led to long-term improvements, which helped the business to thrive. Next slide, please. Everything I've talked about so far was about improving safety at the individual pharmacy level. But reducing the risk of recurrence is about more than just one pharmacy. It's about ensuring that other pharmacies can learn from the error as well. I go back to the learn, act, share, act cycle that I spoke about earlier. At our pharmacy, we learned what happened, and we learned how to make improvements to our system to reduce the risk of occurrence. It was important for me to share this learning with other community pharmacists in this ISMP Canada Safety Bulletin, in the hopes that other pharmacists would then review their compounding systems to identify potential gaps and implement their own system changes to reduce identified risks and to help keep children safe. Next slide, Allie. Thank you.
Thank you, Ina. So hopefully to date now, or to this point, you now have a good sense as to what is CQI, what are the different methodologies that kind of build this this approach to CQI. Then what is the structured way of solving a problem through the DMAIC approach, and some examples of tools that you can potentially use in each one of those stages. And you've now been seeing examples of how real life projects using this type of approach to solve their pharmacy problems. So the big question now is, well, how do you bring this together? How do you start to take this concept and start to inject it into the DNA of your organization? Because one person cannot do it all. You need to start to create a culture of continuous improvement. And that's when you start to have everyone rowing together in the same direction. Well, there's 4 major components to building a culture of CQI. The first is creating strategic alignment. Do you and the organization know what's important? Why are you improving? What are you improving for the sake of? What are the objectives of the organization? What is it that's strategically important to the organization? making sure that's very clear so that you can start to take your resources and move it in that direction, point towards that direction, any projects, any improvements. Second, based off of that strategic clarity, creating some sort of cadence on targeted improvement initiatives, working on specific strategic projects that are going to get you to your goals, and having a regular cadence to that, whether it be 1 or 2 or 3 or whatever number per year. You're working on X number of projects, and on a regular basis, you're using your strategic goals as where to focus in on. The third is to incorporate improvement into daily work. This could be through the use of management systems, like I mentioned earlier, huddle boards, proactive huddles at the beginning of the day where you start to identify risks before they actually come to pass, using scorecards and indicators to really understand the performance of the business. These are some examples of things that you can do to incorporate into daily work so that not everything ends up being a big project. And then the last thing is something that you're already starting to do here today, and that's building capabilities, building the expertise within your organization to improve. Now, there's there's many different levels of improvement, but there's two ones that we want to focus in on today. The first is this concept of yellow belt training. It comes from Lean Six Sigma. Lean Six Sigma yellow belt certification is a level of certification that is great for anyone who wants to be an active participant, anyone who wants to be a part of a problem-solving project. There, it's a one-day type of training where you'll get a lot of the fundamental tools that we chatted about here today, and be able to start to approach the problems using them. The second level of training is green belt training, and this is really good for people who want to stand at the front of the room, hold the marker, and actually facilitate projects. This is much more of an advanced CQI certification level. Now, we do offer both of these here, but today we want to really highlight the fact that we have a yellow belt session, or the QI fundamentals session, that is actually being hosted by ISMP on June 12th of this year. So in a few weeks, it is a one-day session where over the course of that day, we're going to be learning a lot more about the tools that we talked about here today. And through practice and a case study, we're going to actually be applying it. You're going to get to make a value stream map, and use a fishbone diagram, and another tool called 5 Whys, and a variety of different tools, to the point where you are feeling a little bit more comfortable in how to use these tools in a pharmacy context. So if this is of interest to you, I ask you to follow this registration link, use the QR code that is here, and it'll take you to the registration page. With that, and right on time, in summary, I hope that you get that CQI is a formal approach and methodology and a powerful way to drive change in an organization. 2, I hope that you see that establishing a culture of continuous improvement really increases the bench strength of your organization, so that you're not leaning on just leadership to drive change, but if you actually provide these tools and skills to others in the organization, you're actually going to be able to do a lot more. CQI and tools and approaches are applicable in a variety of different problems, whether it be safety, care, administrative processes, support services, you name it, you can apply it. As long as there's some sort of process or problem, you can start to apply the DMAIC approach right away. And finally, ISMP Canada and the Value Collaborative, we have a long history of working with organizations like yourselves and giving them the tools to actually start to solve problems. That is it from us, everyone. We have an evaluation survey that will be sent to you automatically as you exit here today. We please request that you take like 5 minutes to fill that in. In the nature of continuous improvement, it really helps us as getting better at our delivery and seeing what you really want to hear more of. So please, this gentle request would be to fill in that evaluation survey. Suma has put in a link to it in the chat window here below. That is it for today. Thank you for listening. If you have any questions, again, I'll stay on the line. You can put the questions into the chat window here. But for everyone else, thank you so much for your time.